Hi, my name is Konstantinos Economopoulos and I'm a PGY4 general surgery resident in my second year of research. I'm originally from Athens, Greece, have graduated from the University of Athens Medical School, and I'm currently interested in minimal invasive surgery and endocrine surgery. The high clinical volume and our focus in research are unique aspects of the Duke General Surgery Residency program. We are a program with very few clinical fellows, and because of this, most chiefs graduates with more than 1,300 cases. Research is an integral part of the Duke General Surgery Residency program and has been so since Dr. Sabiston was the chair of the department. Our residency is a 7-year program with 2-year research fellowship, usually between the second and the third clinical year. What's very unique at Duke is the wide variety of research opportunities ranging from clinical research, basic science, translational work, global health economics, social sciences, education, but even out-of-the-box ones like history of medicine and medical device design. At Duke, you can literally hone your skills in any type of research you want. Not to mention that many residents, including myself, pursue advanced degrees during this time. Equally important, research time as a surgery resident is financially supported by the department, and although all residents submit an NIH research training grant during their second year of residency, not getting it does not preclude you from doing research here. In addition to that, as a research resident, you are not required to moonlight, but if you choose to do so, then all earnings are added to your salary. I'm in my second year of research here at Duke, and I'm working on medical device design and surgical innovation as a clinical associate director of the Duke Design Health program and master's student in Duke Biomedical Engineering. During my first year of research, I was a fellow of the Duke Design Health program, which is a patient-focused program that discovers the pressing needs in healthcare and assembles teams from across medicine, engineering, business, and other disciplines to create real-world solutions. The most exciting part of my research is being part of the COVID engineering response team. A few months ago, when COVID-19 completely changed our lives, this team, while in constant communication with the Duke University Hospital leadership, aimed to quickly come up with solutions on pressing needs that emerged because of the pandemic. Within a few weeks, we were designing and 3D printing face shields, optimizing surgical gowns and helmets, and building patient isolation systems. A lot of the conversation had involved adapting and improving existing personal protective equipment in order to protect us, but we started brainstorming and thinking outside of the box, and that's when we started discussing the possibility of potentially isolating the patient within the room. That led us to come up with Coviads. We came up with the idea to develop a portable clear isolation system that could go over a hospital bed and protect healthcare providers from coronavirus. Within 5 months, we designed, built, and tested this device, and we are currently awaiting the FDA to authorize the device for emergency use during the pandemic any day now. The collaborative nature of Duke across disciplines and the infrastructure set up by the Duke Design Health program and the Department of Surgery were key ingredients for the engineering response team's success, and I couldn't feel more proud, privileged, and honored to have been part of such an endeavor. It really kept me going during the pandemic. 3 years ago, I started my residency here at Duke, having a 2-year-old daughter and a 4-year-old son. Being a general surgery resident and a parent can be particularly challenging, and although credit should go entirely to my incredible wife, who is also a physician, I found that the support from co-residents and faculty have been instrumental at times in me being able to navigate this challenging undertaking. Having been a dad and a trainee in Boston, Massachusetts, which is undoubtedly a great place to be, prior coming here in Durham, I can safely say that Duke has the unbeatable combination of being a top-tier program in a perfect place to raise a family, space-wise, weather-wise, and financially-wise. The Research Triangle area offers so many outdoor activities for the family, and the weather is almost always nice. The little things we live outside of the hospital with my family here really add value to the overall experience, and having a good quality of life, I feel, is crucial during the challenging times of residency. The most exciting part of my experience as Duke surgery resident is the people. I am always excited to be part of a team where I can get inspired and inspire, get motivated and motivate, and most importantly, share. That component at Duke is extraordinary and so multidirectional. Everyone here is determined to put out 100% of their effort, and this is pretty evident from day one. It is very inspirational for me to be part of such a diverse and talented community. It makes me happy and motivates me to push myself to reach my own limits. Being a general surgery resident at Duke has been an incredible and extraordinary experience.